The present administration in the state is working diligently to boost public access to healthcare facility, especially at the grassroots, through infrastructure renewal of the existing primary healthcare centers across the 5 divisions of the state. Commissioner for Health, Professor Akin Abayomi, confirms government's plans to bring qualitative healthcare to the doorsteps of Lagos residents, irrespective of where they reside.
When we know that we've spent money on a building, then the general population can imagine that you've also spent money on what's inside the building. And so it will become more of an attraction to our community, we can then encourage them to take up their Ilera Eco insurance, which will be delivered at these kinds of facilities as the primary target.
Since the assumption of office, Mr. Governor has put measures in place to revamp, rejuvenate, and reposition the sector for effective and efficient service delivery.
Noting the uncommon passion of the Sanwo-Olu administration to improving the health sector, other stakeholders stress the need for medical personnel in the state to justify such a huge investment, whilst injection of more funds, improved infrastructure, among others, were recommended for a better health delivery system in line with global standards.
The health center needs a competent health worker to make it a very efficient health center. And we see all our health workers leaving Nigeria, going for greener pastures. So we need to have an alternative to the provision of health workers. And the only way we can achieve this is to introduce digital health.
Every chairman will go and do their blood pressure check in the primary health care center in that particular locality. It will drive traffic, it will drive their other friends, other colleagues to come to the place. We must make the primary health care very popular in our locality.
The challenges we have, are actually a bit enormous, and that might not really help us to achieve as much as we would have loved to achieve. And part of those challenges, particularly like every one of us know, is the challenge of human resources for health. We have a major challenge with human resources for health in Nigeria as a whole, and we have a flight of healthcare workers from the country to other developed countries of the world. So this has posed a major challenge to achieving universal health coverage.
Members of the public are encouraged to effectively utilize infrastructure provided with taxpayers' money in their areas with necessary feedbacks for improved service delivery. Samuel Dada, LTV News.